Good morning, everybody. So, how are you all? Like you are enjoying your classes? You have already attended biochemistry lab, anatomy lab, and physiology lab, right? You have seen those. You have also visited hospital. So, you are enjoying or not? Okay. So today we are taking a very important topic, that is patient safety and biohazard safety. As you have already started going to the hospital, one visit you had in the hospital, so you can relate that once you're in the hospital, so many people are there, right? There are patients' relatives, there are doctors, nurses, technicians, technologists, and also other general duty staff, the housekeeping staff. So there's a lot of people involved in patient care, right? So once you become a doctor, you imagine yourself, you are taking care of a patient who needs some emergency care. Maybe he is going to the ICU later on, so he needs the ICU care, or you become a surgeon. So you have to operate on a person, right? Or you are working in a lab as a pathologist, where you have to see that one patient's blood has been properly taken or not. Okay. One thing, I don't want anyone to have your mobile phones on now. Please put it down or off or whatever, right? Because whatever I am saying here today is very important, because I am coming with a lot of experiences, right? So these things may not be written in books. Okay, it's not that you will go home, read a book and you can absorb, or everything is not written. But some things are there which you will get to know because when you work in the hospital, right? So that is the reason I am asking you, please put your mobile phones away, and it should be for all your classes. Okay, and that is also showing some respect to your teachers, right? The person who has taken so much pain to prepare the classes, you have to be attentive and you will be the gainer. Okay. So what I am saying is, when you are in a setup where you have a very vital or pivotal role to play. So, and what you are going to do, you are going to take ultimate care of the patient, to see that the patient, with whatever problems he had come or whatever pain he had come, he goes back happily, right? That is the whole intention. So here comes the main role of seeing that the patient is safe in your hands. He is safe in the environment he is in. Okay, so there are a lot of things which comes in this, seeing that he is safe. To start with, I will go to the next slide. The simplest, if I define safety, patient safety, simplest definition of patient safety is the prevention of errors and adverse effects to patients associated with health care. Any adverse effects we don't want to happen. The origin of the concept of patient safety came with the Hippocratic Oath. You will also take an oath before doing practice or starting any medical profession. You will take an oath. So what does the oath say is never do harm to anyone. So that is the main thing. The patient comes to you, you should not cause any harm to him. You are trying to save his life, you are trying to help him. So never do any harm. So he has to be safe, right? Next is, I will talk about this doctor. Dr. Lucien Lipp is a physician and professor at Harvard School of Public Health, and he is also considered as the father of patient safety. He saw that a lot of things comes in when you are dealing with the patient. So how to keep that patient safe? His groundbreaking work highlighted the systemic nature of medical errors. So there are so many errors that happens when you're working in a system, in a hospital. So he has tried his best, and that's the concept he has given is, and every year the World Patient Safety Day is on 17th September. So all organizations in hospitals, medical colleges, clinics, or PSC or CSC, they observe this day, they do some activities to promote this patient safety efforts. Next comes factors which can lead to healthcare errors. Okay, So there are certain factors. The first factor is human factors. We are all human beings after all. We are not machines, right? We are not robots that something has been put in your all commands and you are following one after the other. So we are human beings. We tend to make mistakes. We tend to get tired. After, if you have got a long shift, so many patients or maybe 5 or 6 patients comes together and you are alone in the emergency, you tend to get tired, you tend to get busy, or sort of one person is neglected from the other, from the patient. So those things, human factors do happen, do occur. Next is medical complexity. Our human body is very complex. It is not 1 plus 1, 2. So there are certain diseases like, you say autoimmune diseases, the cancer, diabetes, which involves lot of systems. So there are many neurological diseases. One at times when if you're working in a PSC or CSC, you don't have the facility for doing the diagnosis, proper diagnosis of a particular patient, right? So may you have to send him to a tertiary care center, or maybe only one center in India you have. So that is what is the medical complexity. Or you may take a second opinion or a team of doctors talking about what to do with this patient, right? Next is system failures. So we work in now things have upgraded, our hospitals work in a system where we have computers working with us to store the data. Suppose we are doing one test in the lab results goes directly to the doctor's office or in the ICU or the surgeon's office. He can see the test results. So that is how nowadays things are functioning. But at times it happens the system may fail. Okay, there is some internet problem, or there is any sort of problem has come up that there is breakage in the computer or in the system, the whole system is going to fail. Then what to do? Obviously we'll have some other way, where you have the conventional method to write it down, the reports and all. But then there's some delay in that, right? So there may be system errors. Then inadequate communication. This is the most important thing. Communication. I already told you in the first day about communication, and another class I have on communication. So when you are taking an order or you are taking some advice from one of your seniors, you may be doing that, whatever job he has given you, and maybe you are passing on the communication to your junior doctor, or maybe rest of the staff, the nurses, technician, technologists. So there is chances of gap in that communication. Communication, again we'll talk, there are many types of communication and all stuff, right? So now let us see what is the goal. Patient safety goals. There are some international patient safety goals. First goal is identify patients correctly. So, patient comes to you, there are maybe 5 or 6 patients in the OPD, they're there, and then you are taking blood or taking blood culture, whatever sample you are taking. So then he comes with a requisition, with a form, right, an advice, and then he also comes and then you ask him to sit there. You are right, you have some blood tubes, collection tubes, now you have to ask him what is his name. Because don't just think that, okay, I have called, this person has come. Maybe the same name you have 2 patients. It happens. So we have to identify the patient properly. So we'll again go in details about it. So then next is improve effective communication. Again the communication is coming. Second most important goal. Third is ensure correct site, correct procedure, correct patient surgery. So there are many cases where it has been seen that patient went for right knee replacement, total knee replacement, but ultimately it happened that he had the left knee replaced. The cases are there, okay. So there was some gap in this, the communication gap, or is not properly identified before the surgery. So these are the problems which have come out. So the emphasis on patient safety has come up, right? Next, we'll talk in details about it, how to avoid this happening. Next is goal number 4 is improve the safety of high alert medication. Very important. In the ICU, in the MICU, we have many medications which we use for their high alert medications. Person A and person B, two patients are there, it is to be given to person A. If person B takes, he may die. You understand? Or there is a particular dosage to be given. Though he is not given the proper dose, high dose is given, there is an issue there. So that is the goal number 4. Goal 5 is reduce the risk of healthcare associated infections. So patient comes to you in the hospital, maybe he has come for a plain surgery or with a myocardial infarction, and then he stays in the hospital for 1 month, 5 days, 1 year, maybe 15 days, and he gets some infection from the hospital. So we don't want that to happen, right? It's very unfortunate. Next is goal is reduce the risk of patient harm resulting from fall. If you have one aged grandmother, grandparents, you will see they have a tendency to fall, right? Or maybe due to some medication, they may have the tendency to fall. So we don't want that to happen. They should not have any incidents of fall in the hospital. Next, patient safety. Broader term you say is we are looking towards safety of people, safety of place, safety of our property. Safety of people is patients. We are looking at most, then is staff, all the staff who is taking care. Even they should not get any infection from the patient, right? Next is the visitors. The visitors are coming, means their patient party or patient relative they are coming. They should also not catch up any infection or any other, they should also be safe, right? So that is what we look after the people. Safety of the place, we have infrastructure, all the buildings and everything, the safety measures, what is taken. The whole design, the civil work is done of a hospital looking after the patient safety. Okay, and then fire. Fire is a big thing. You'll see in a hospital they have a ramp so that if a fire breaks up, how to evacuate. All the patients has to be taken away. The staff has to go. There are drills for the fire, so that people know what steps to do once there is a breakage of fire. It's very unfortunate, but it may happen. Then there are fire extinguishers. Without that fire safety measures, you are not supposed to operate in a hospital. Next is electrical and mechanical. These are all like electrical or appliances are there or electrification is there. All those things has to be properly done with all safety measures. Next comes safety of the property, equipment, stores, assets. The store, I will say, we are keeping in a hospital, we have got stores in different sections. Stores in the OT, stores in the pharmacy, right? You store the things. So, for example, store in a pharmacy, you have to see that it is properly kept. The medicine, if it is written 25 degrees or it's written 0 to 8, so it has to be kept properly. So, all those things are there. Assets. Hospital has got, or healthcare facility has got a lot of assets. So, that safety also is to be seen. Next comes our first goal. We'll take up each and every goal individually. So first goal is identify patient correctly, preventive measures are developed, safety policy and protocol on accurate patient identification. See, nowadays we have got hospitals which can take accreditation from national bodies. We have got, for example, for the hospitals we have NABH, means National Accreditation Board of Hospitals. For labs we have NABL, National Accreditation for the Laboratories. So what are these accreditation? Accreditation, these boards or organizations, they are a body, they have come up with certain guidelines or policies which they have found is the best. Okay, they are standardized. So they have, suppose you have hospitals, suppose you are working in a hospital under NABH, so you have to follow those guidelines. So those guidelines are all for this safety and many other things. You understand? So according to those guidelines, the policies, we have got SOPs. We call it in short form SOPR. We'll talk many times, SOP, this, that. So this is Standard Operative Procedures. Okay, so if you want to do anything, and suppose you want to put a catheter in a patient, there is a standard operative procedure for inserting a catheter so that the patient doesn't get an infection due to while introducing the catheter. You will be doing all these things. Okay, so those standard operative procedures are already set guidelines or policies. That is what they are saying. We have to have a policy. Okay, next is use at least 2 patient identifiers when administering medication, blood or blood components, and when providing treatment or procedures. So, many times it happens, we have maybe Mr. Amrit Jain. So, you have 2 Mr. Amrit Jain in your OPD or in your ward. Okay, so if you write only Amrit Jain, that doesn't suffice. You will be making mistake, right? Then next identifier is what? We usually put the age. Okay. Then we have another identifier, that is one unique ID, one unique number. Okay. So every patient, anywhere you go, you will be given one number. You will notice there is a number. So that number will be there everywhere. In your reports, right, in your prescriptions, if you are going for surgery, then everywhere it will be the same number. So we have certain identifiers, at least 2 and more. So they are saying at least 2, usually you have 3. Okay. So that is how we can omit that error, like of identification, the first goal. Next is label containers used for blood and other specimens in the presence of a patient. So you are working in ICU setup, you have 3-4 patients. So every day morning you have to take blood, you have to see what is the hemoglobin count, what is the sodium, potassium, what are the electrolytes. You have to do those, right? Accordingly, the doctor will give, your senior doctor may give the instructions what to do. So suppose what happens, imagine you go to patient A, patient B, patient C, you collect everybody's blood and then you keep on writing their names. So what is going to happen? All mix up, so you will not get anything proper. It will be all hazards. That means the whole thing will go wrong. So what you have to do is, you have a cart or you have all your instruments together. What I am saying, you may not be taking blood, you have to know how to take it. You have to instruct your juniors if anyone is taking, maybe the technician. So you have to have a whole knowledge of everything what is going on in the hospital as a doctor or maybe in charge, right? So patient A, the person who is taking the blood, he goes to him, he takes his blood, identifies he is that patient, sees the instructions, and then he writes the names on the vials there, the tubes. Then and there, he finishes the patient, everything, then he goes to the next patient. That is how things should be. This is called organization skills, how to organize your work, right? Eliminate transfusion errors related to patient misidentification. This is very unfortunate. Suppose a patient has blood group A positive and due to this sort of, misidentification, he gets B positive blood. So what is going to happen? There's mismatch of transfusion and there will be a lot of problems coming in, right? You may even lose the patient. So next, failure to identify patients correctly. So what happens if you don't identify the patient correctly? Medication error. You may be giving the medication to another person. The person, not to person A, you are supposed to get it, right? Next is transfusion error. I just talked about it. Testing error. You are testing one blood, patient A blood, but you are giving report of patient B, right? So testing error. Then wrong procedure. Again, wrong procedure I was telling you, where the surgery has gone wrong. You have not doing on the right patient, right? So all those. Next comes improve effective communication is the first goal was identification. Next is effective communication. Next goal, reduce medical errors by establishing clear communication process. It should be very clear. So you have to be a very good listener first of all. If you are communicating, you have to be listener and then you have to be a good communicator. You have to talk clearly. It's not that murmuring little bit, you are talking something and your junior staff or nurse doesn't understand, right? You have to talk clearly and you have to be a good listener also. You have to know the language. You have to know the local language too. When you go to the wards, you have to know Bengali, who is from Udaipur. You are from Udaipur, right? So you have to learn Bengali also because you will be seeing patients. Huh? Agartala, Tripura? Okay. Anybody from outside? Okay, you know Bengali, right? So it's very good that all of you know Bengali, because most of the people here speak in Bengali, majority population, and also Kokborok. So that language also, if you know a little bit, is really good. At least the things like common things, what you want to ask, right? Or you have to have an interpreter. That is what people usually do if it's from a foreign country, the patient, and you have to have an interpreter. Fostering a culture of openness among healthcare staff. It should be like you have to have a communication. If you made a mistake, tell the mistake. Just don't cover it, because one mistake will land up, covering it will land up in lot of many other problems, right? So you have an openness among your staff or the team. Improve effective communication involves a sense of situational awareness and great listening capacity, as I was telling you. Effective communication is an art which can be taught as well as learned. You can learn it, you can develop. Don't think what you have today you will have it at the end of the year. Definitely it will become better, but you have to put efforts for it. Next, the intent of this goal is to improve effective communication through implementation of process or procedure, taking verbal or telephonic orders or for reporting critical test results. Here I will elaborate. What do you mean by critical test results? One patient is admitted in the hospital. These are the scenarios. If I give you real life scenarios, you understand better, right? Or he is in the ICU. His electrolytes. You know what is electrolytes? We have got electrolytes in our body which has to be in a normal physiological range. Sodium, potassium, chloride, these are the three electrolytes. So now, sodium level, if it is less than 120 or if it is more than 160, it is alarming or is in the critical range. Okay. So if a patient you are treating and the nurse comes and tells you, okay, this patient we have to send for getting the electrolyte done. Okay, you get it done, and then from the lab he sees the patient is having 118 maybe sodium. So now it is in the critical range. So what they will do in the lab? They have a whole register where you have to write down the critical test results separate. There the technician will on that, just seeing the result, he has to then and there write the results in a small piece of paper, sign it there, and then send it to the ward. It may be any time of the day, any time of the night. It may be middle of the night. Okay? And he has to communicate on phone also. Both the things goes together. That this patient is having abnormal critical results, is a critical alert. Even in the computer, when you put the results, there is a flagging where you can see it is critical. So, and then the doctor, if you are the doctor there, you have to take appropriate steps to correct his electrolytes, or you may lose the patient, right? So these are the critical results for hemoglobin and many other analytes we have got critical values. If a patient is having, when you are doing test, you see he is HIV positive or he is hepatitis B positive, and the patient is going for dialysis. You understand dialysis, right? Okay. The artificial kidneys, dialysis. So what happens is we have got many machines for dialysis. Maybe 10 machines you have 2 machines or 3 machines separate, one for HIV patient, one for HCV patient, one for hepatitis B patient. You understand, right? Hepatitis, you understand? This is a viral infection, hepatitis, which affects the liver. Hepatitis A, B, C. But B and C is transmitted through blood and blood products. Okay. So we are concerned about B and C in the hospital. Dialysis patients usually get C while getting the dialysis. Maybe he has been mixed with a patient positive and he was not negative. It's very unfortunate, it happens. So as soon as you see this test result has come, hepatitis A or B, hepatitis C or B, then what you have to do is, you have to again, this is a critical alert. You have to tell this patient for dialysis is having hepatitis B. So accordingly, they will put him in that machine. You don't want to contaminate the clean machine, and other patients who are coming in the following line, they will get the infection. So you understand, so important it is, right? So next comes factors contributing to miscommunication. Patient handover between units and amongst caregivers. So what happens when you have 24/7 working hospital? There are shifts. You'll be working in shift. Okay, so suppose a shift has been done at 2 o'clock, the next shift people come, the doctor, nurses, everybody comes, the whole team comes, right? So the team which is going away has done their job, they have to give proper handover to the next shift. How much work is done, what is left, which medication to be given to the patient, right? If you don't give proper handover, then again is a problem. This is an error, communication problem. Then misunderstanding of information, lack of good communication, language barriers, patient care orders given verbally and over telephone. Sometimes when you talk on telephone, some of the things you don't listen, right? Some of the things you miss. So many things like critical test results should be given in written. Okay, many things you have to write and give in written also. Then eligible orders, this will be like, so develop written procedures for managing the critical results of test and diagnostic procedures that I already told you. Implement the procedures for managing the critical results of test and diagnostic procedures. Implement it, develop it, the policy. Every hospital has got their own policy, how to do it. And accordingly, the staff is trained. The only thing is you have to follow it. Evaluate the timeliness of reporting the critical result. So it should be not that 1 घंटे बाद बोल रहे हो, 2 घंटे बाद बोल रहे हो, ऐसा नहीं होना चाहिए. It should not be like that. कुछ फायदा नहीं है उसका. You have lost the patient, right? So it should be on time. Next, ensure correct site, correct procedure, correct patient surgery. So this is important. Correct site, which area to be do the surgery. Now come to surgery. Correct site, which area? Correct procedure, which procedure to be done? And correct patient, whether you are choosing the correct patient. Okay, those things are ensured. How do you ensure? We have checklists. Checklists are standardized, documents. Every organization has. Only there will be small, the topic will be written, whatever it is, and it will be, there is a block kept there, you have to just put tick. So it's a checklist. At the end, you have to see, okay, these are the things. I'll show you one checklist. Then patient consent. Okay, the patient has to give consent before going for the surgery. Okay, any mishappening happens for the surgery, I give consent to it. Okay, or the patient party has to give consent. So the consent is important, or else you will be landing up in some problem, medical legal problems. He may even drag you to the court, right? Sorry. What is your name? That's the boy behind you. Hello. If you have water, you can just drink little water. Okay. And teamwork to minimize surgical risk. So you need a whole team to work properly, to have the checklist, to get the things done properly, so wrong body parts, wrong surgeries, wrong patients. It do happen. And there are many cases when doctors have even landed up in jail because they have not done their job properly, right? Maybe the team members did not do it, but you have to have a proper, training of your staff. All the people who are working with you, they have to be well trained, they have to be well versed with what they are doing, and they have to do their work in a very diligent way. No, there is no chance in medical, there is no chance of, just letting it, okay, ho jayega, not like that. You have to be there because the patient is a person's life, right? So, next, there are certain protocols they have come with, the surgeons. They have seen that if you do this, then there will be this, things will be done properly. One protocol is marking the surgical site. So you see here, they have marked. The doctor, when the patient is in the ward, usually one day before the surgery, he is put in the hospital ward, right? So do his workup for the preparation for the surgery. So usually he will mark this area or this limb is to be operated on. So the marking is done. And then a pre-operative verification process is there. All details are verified at least one day before. and a timeout that is held immediately before the start of the procedure. So, where the entire operating room team reviews the patient's identity, the procedure, the surgical site before surgical insertion of the start of the procedure. Just before the start of the operation, there is a timeout called. The whole team will see that all things are done, working in place. Okay, so there is less chance of doing wrong. The organization needs to collaboratively develop a policy or procedure that is effective in eliminating this disturbing problem. Few examples: ensure preoperative skin antisepsis such as basic soap and water shower. So one of the examples I gave you is like, you must be knowing, if anyone goes to for an operation, the doctor will advise, come have a very good shower, scrub yourself. Okay, scrub yourself and then come for the OT next day. So that is, we'll talk in details about it. So why they ask you to scrub yourself? There are cases that the operation has done very well, the OT was done fantastic, the surgeon was very happy and everything, but what happened? When he went home, he landed up with some infection. Postoperative, we say it, surgical site infection, SSI. In a hospital, it happens because maybe the patient did not take proper bath, he was not taking proper care. Maybe something happened during the surgery where the instruments are not sterile, maybe chances are there. Or maybe when he went home, he has not followed the instructions. During the discharge summary, there is a whole list of instructions for the patient. You have to clean your wound, you have to take a bath with this antiseptic, So those he has not followed. So there is a break in that. Next goal is medication safety, minimizing the risk by implementing stringent safety protocols. Medication safety. Common errors of medication errors. Common causes of medication errors, human factors. Okay, there are human factors, system, abbreviation. We'll go one by one. We have seen the human factors. We have seen the human factors where human beings, they tend to lag down, or they may be, not properly communicating, or they are tired. So all those factors contribute to causes of medication error. Or communication is a big thing actually. Then comes about system failure, I told you in the beginning. Then abbreviation. Sometimes we don't understand the abbreviation, whether it is given OD or TDS, you learn those abbreviations. 3 times daily or BD. The abbreviations, if you don't follow, then you cannot give the medication properly. Then we have verbal orders, whether the verbal order has been taken properly. Look alike and sound alike drugs. Sometimes 2 medicines look alike or they sound alike. So those are there. Then dosage calculation. Suppose this is the maximum dose you have to give per kg body weight you are measuring. Okay. So per kg body weight you have to calculate the dosage. You learn all this in pharmacology also. But now what you do is, you don't know how to calculate the dosage properly, or you have not calculated. You give very much high dose. Okay. So there is a drug like heparin. Okay, there is a blood thinners, and then you may even kill the small, if you're putting it in a small baby, patient may die also due to internal bleeding. So, dosage calculation, so the dosage has to be calculated properly. So, you cannot, as per whatever you will be learning in pharmacology, or whatever you will be in your duration, and then when you're practicing, you have to calculate the dosage per kg. So one person may be 60 kg, one may be 40 kg, right? So the dosage also varies. Then at-risk population. This at-risk population are the people who are in the extreme of ages, or they are immunocompromised, like the aged people whose immunity is down, or maybe the neonates, small babies. This just after birth, at least 6 months after birth, their immune status is very low because they are not able to make the body system, the immune system is not prepared to fight against the bacteria and the viruses. So those extreme ages or immunocompromised, if a patient is HIV positive, his immune system is low. Okay, he cannot fight against other bacteria, viruses, whatever is coming, and so he catches other infections. So these are the at-risk populations, or if he is under chemotherapy, taking cancer drugs. Okay. At-risk drugs, there are many lists of drugs which are, high alert drug medications. High alert medications, we come here. Improve safe use of high alert medications. Higher risk of causing serious harm to patients if used incorrectly. For example, chemotherapy. If you are giving chemotherapy to a patient A and accidentally give to another patient, you can understand what's going to happen, right? Next is oral or parenteral medication, antithrombotic agent, where is telling about the heparin. Then insulin, potassium chloride injections. These are the electrolytes. So these are very high alert medications. You have to give in particular dosage and to a particular patient. You cannot just, we have to be very careful about it. Medications are part of patient treatment plan. Appropriate management is critical to ensuring patient safety. Medication orders, see here, this is very important. And prescriptions to include both generic and brand name, along with the dosage, strength, direction for the use. What is this generic name? You understand? Generic name in pharmacology, when you read, you will get the generic names. These are the molecule names. Okay. And then there is a brand name. Brand name is given by the companies. Okay. If you have got chloramphenicol, it's a generic name, an antibiotic. Or you may have azithromycin, it's a generic name. So, similarly, for that azithromycin, one company like Cipla, Sun Pharma, they must be preparing some other with another brand name. Okay. So, you are supposed to write both generic and brand name along with the dosage, what dosage to be taken, strength, what strength to be taken, and also direction for use. How to use it, once daily, twice daily, or after meal, before meal, whatever. Right? All those has to be there in a prescription. Usage of standardized abbreviations or acronyms. Sometimes we use abbreviations, SOS or like this. There are many abbreviations, but those are standardized. Then doctor prescription to be legible and preferably in capital letters or computer types. Very important for you. Okay. So what happens now? You are starting. The start should be good. So make from now onwards. You may be when you write your notes. You're writing notes, right? When you write notes, write in legible words. You'll be practicing you'll be writing prescriptions later on, right? So if you write a prescription, the pharmacist doesn't understand, the patient doesn't understand, how is he going to take the medication, right? So all those are important. It has to be legible and in capital letters. The NEET-UG, the standards are, it has to be in capitals or it has to be computer typed. Many hospitals has got like computer generated, the doctor types there because these days we are more well versed with typing, right? So the doctor types them, this is much better. So these are the things. So you see here in the first one, you can see the prescription, I put 2 prescriptions. The top one, you cannot make out anything. What the patient is going to do, what the pharmacist will do. But the bottom one, you can very easily read what is the instructions, the name of the patient, the medication, 4 ml, QC, everything you can read properly. So that should be how you, if you are working in it depends which setup you are working. You may work in a PSC or CSC where you don't have the computer facility, then you have to handwrite. Then write it in this way. You may work in a corporate hospital, okay, multi-speciality, super speciality. One day you become a gastroenterologist, whatever is your dream, right? Yeah, you will become. If you follow your dream, you will become. Okay, so then you will be working in a corporate where they have got all the computerized things. Then you have to type, right? So this is adaptability or learning skills. So you learn those. Goal number 5 is reduce risk of healthcare associated infections. This is the most important thing. As a microbiologist, I can tell you for hours on it. Okay, I can talk with lot about it. How to avoid infections to the patient who has come to you, how to keep him safe from other patients. Simple one example I'll give you. A patient comes to you with a Klebsiella. We have got an organism these days which is really causing a lot of problem with the doctors. It's called as Klebsiella pneumoniae, MDRO, Okay. Have you heard of Klebsiella pneumoniae? In microbiology, you will read a lot of bacteria's name. Okay. You have to know those by heart also. So Klebsiella pneumoniae is 1 gram-negative bacteria. Now it will be a little bit difficult for you, but it is, I'm trying to make it easy for you, but it is MDR, means multi-drug resistant. You understand the word multi-drug resistant? Or it may be pan-drug resistant, means all antibiotics are resistant. So what happens? The doctor doesn't have a choice to give to that patient, to treat the patient. Okay, all the antibiotics, you understood this much, right? All antibiotic resistant. Now what is going to happen? So this patient, we have to put him in an isolation room. Have you heard of the word isolation? So there are isolation in the ICU. We have isolation facility in the wards, where you have to put him in a separate room, separate facility with all the things inside for him. Okay, the doctor goes inside with all his PPE. You have just now learned about PPE. Huh? With the PPE going inside, when he is inside, he has to remove the PPE, come out. So all these protocols are set. So that, why it is done? So that the other patients who is in the ICU don't get infected, don't catch that infection. So otherwise it is going to be a crime, right? You are giving infection. How can you give? How can that patient have infection? Can anyone tell me? If I am having one patient who is in the ward, who is having multi-drug resistant one bacteria, so how can he get infection, give infection to another patient? How? What is the mode? Sneezing, coughing, anything else? I can give one hint, like we are working, right? Nurse is going, I am going, doctors are going, or you are going and helping the patient, giving him medicines, everything. The GD is coming, the housekeeping is coming, everything is required. So it may be that cross-contamination through the hands. The hands are the most vulnerable things in the hospital. So you will have a whole class on hand washing. How to do hand washing is very important. When you go to the wards, please make sure that you learn the steps of hand washing, and whenever you are seeing, before seeing a patient you have to wash your hands, and after seeing the patient you have to wash your hands. I mean to say examine, always. That has been seen with research, with lot of efforts. They have even changed the handle, with copper. Many hospitals. They have changed a lot of things because there's contact, right? All the time everybody is going the handles. But they have seen the best thing to do is to wash hands properly. To wash hands, washing hands. So there's a lot of effort in a hospital. You will see that we are doing all efforts. Wash your hands, wash your hands. You touch a patient, go to another patient without washing hands, you will give the infection. You understand? So that is how to avoid. Patient continue to acquire infection while receiving care, treatment and service in a healthcare organization. Therefore, prevention and control strategies must be tailored to specific needs of each hospital based on the risk assessment. Promote effective hand washing or hand hygiene. Either hand washing is the best if you have, or else sometimes you have what is that called? Hand rub, but there is a technique of doing it, the whole thing. You will be taught about it also. Now, 7 strategies to prevent healthcare associated infections. In the core, we have got safety culture. The safety, all the cultures you will be learning about safety. This is the core, which you have to follow. It's not only you are learning, remembering, but you are doing it. Next is following guidelines. There are guidelines, there are SOPs, there's a policies of the hospital. You have to follow that. Every hospital has got their own guidelines. Antibiotic stewardship is a program where every hospital has got antibiotic stewardship, where you give the antibiotics to the patient as per the local antibiotic prevalence or incidence. What is the antibiotic sensitivity pattern? So suppose we are having a group of antibiotics. Now in Agartala, the antibiotic sensitivity pattern will be different from USA. You understand? So we have to do a study of the antibiotic sensitivity pattern. That is done with, I usually do it like with the time, maybe within over one year, you have to see that, okay, this Klebsiella or E. coli or Staphylococcus, it is sensitive to which antibiotic. So that is a whole data thing, statistics, and then you come to a conclusion. If a patient has got MDRO or if a patient has got E. coli infection in his UTI, urinary tract infection, you have heard, right? So if a patient comes to UTI in my OPD, UTI, you understand? Urinary tract infection. Okay, it may happen to somebody. So, what antibiotic I am to give? You know, you go to the hospital, the doctor writes, if you are coughing or sneezing, he writes an antibiotic, right? The correct way is you have to do a culture. You guys should start to think like that, rationally. First you have to, this is called evidence-based medicine. You should have an evidence what is the cause of the infection, right? Just don't write the medicine. Write a culture to be done for the sputum if he is coughing, for the urine if he is having urinary tract infection. Are you understanding what I am saying? And then you go to write the antibiotic according to the sensitivity pattern. But sometimes it happens in the hospital. When a patient comes, he is in sepsis, you have to help him. Sepsis means infection in the blood. Okay, the patient doesn't have time. It is the golden hour, 1 hour you have to give him the all medications. So then what to do? You have to give him some medication, some antibiotics, so that thinking that he may be having this infection, right? So this is the antibiotic stewardship helps there, where you have a whole data or the statistics of the locally prevalent antibiotic and also of the particular organism which is going, you think that, okay, this may be with your experience, this may be the organism which is infecting, so I want to aim and kill that organism, right? So that is what we do in antibiotic stewardship program. Every hospital has one. Then surveillance activities and screening and cohorting patient. This is what I was telling you about the cohorting, isolating the patients or screening them if they need different care. Then environmental hygiene. This environmental hygiene is very important. Environment means what? What is your environment here? This room, your desks, the floor, right? So that hygiene is also has to be taken care. So in the hospital, you have so many surfaces. You have any issues, problem? You want water? Okay, you okay? Okay. So in the hospital, you have many, what do you say? I can say everybody, you know, everybody's face I can see. If any problems, you can say. So in the hospital, you have got floors, you have got so many things, right? Contact surfaces. So those surfaces has to be kept clean. In a good hospital, you will see they are mopping at least 3 to 4 times in a day. Okay, and also depends on the traffic. If more people are coming, more number of times you have to, the frequency has to be increased. So that is how you are doing the environmental hygiene. Even the environment, we take air cultures. On the OT, for the operation theatre, we have got a facility to take the air cultures, so that you can know what is the quality of the air, whether there is bacteria in the air or not. That's the environmental. Next is the hand hygiene that I already told you. See, it's a big thing, right? So hand hygiene is the most important thing which you have to do. So use of your personal protective equipments, you have already read about that. All the personal protective equipments, which includes mask, your gown, then gloves, okay, and footwear. You should wear for your, even for your hospital and your clinics, practicals, you should wear covered shoes, okay. Everybody should wear covered shoes, no open slippers. This is safety for you. First of all, you have to have your own safety. Okay, when you go to the hospital, do you have a hospital visit? Okay, when? Okay, so please wear long sleeve shirts, okay, cotton long sleeve shirts. That is for you, for your own benefits, and shoes, and properly groom yourself. You will be given your dress within few days. I think you will have one apron, but till then, if you are not getting, wear long sleeve shirts and pants, and whatever you are wearing, the dress is fine, but put covered shoes, okay. And if you have an apron, you can wear one, or else we'll be giving you, okay. They'll be giving you definitely apron. So that is all the things, and it also depends. We'll see later in the next my biosafety. We'll see more about the what you're going to wear. Next goal is fall. This is the last goal, I think. Fall, reduce risk of patient harm due to fall. See, fall is so important. Patient is seduced, is drowsy due to medication, goes to the this toilet, and then he falls. Old patient, imagine, he's having a hip fracture, the long bone fracture, and hip fracture is a very bad fracture for an aged person. He may land in, the patient may die of that. Maybe he has come for some heart problem. So we have to ensure that, right? Assess the environmental factors and patient factors which could lead to patient fall. So always after admission, assess him, see what he needs, extra care for he is so preventing the fall. Develop and implement protocols for preventing patient harm results from the fall. Conduct fall and injury risk assessment upon admission, and also maybe values if he is admitted for 1 month, you have to see whether he has the prognosis is bad, so then you have to maybe reassess him again. Use non-skid, there are many things what they do in the hospital. Non-skid floor mats, or maybe non-skid tiles. Usually in the washroom you have got non-skid tiles. Hip protectors, individualized toilet schedule, or adjust frequency of the rounds. Maybe you have to go and see often, or the nurse maybe have to go and see whether it's okay. Review, or sometimes they have usually in the you see in the hospital they have got bars for holding for the aged people, for the patients who are requiring that to avoid the fall. Or if there is spillage or there is mopping, you will see the this wet floor caution sign is given. So all those things are there in the hospital. Next is the fire safety. What I was telling you, in the nursing home and hospitals, they don't get a permission to operate if they don't have the fire safety measures. The government doesn't give it. So you have to have a ramp, you have to have fire extinguishers, you have to have fire hose, you have to have all your, staff trained how to fight against fire. Fire can be any sort of fire, electric fire, whatever. There are so many types of fire. So those, you will also be trained for how to operate a fire extinguisher. Okay, so those trainings will be there. Next, I was talking about patient safety checklist. These are, I will not go in much details. This is a checklist. So you can see each and everything which I have talked about the goals. It is written in the checklist. So if it is done, for example, discharge planning. Discharge instructions provided to patient and family. Tick. Discharge planning. Sometimes after post-operative, when you are giving him the instructions, you have to even show him a video maybe, how to take care of your wound. Or maybe you are showing him some, photographs or some videos. So that is how you have to have your communication done with the patient. So it will give a better outcome. Biosafety. Next is, we have finished or done with the patient safety. Now is the biosafety. Biosafety is basically, now here we are talking about, we have talked all about the patient safety, right? Now we will talk about, suppose you are working in a lab, or you are working in a research lab or a diagnostic lab, then what all safety measures you have to take for yourself and the environment. So that is there, because with COVID, which was really a big problem, it was a pandemic, and it has taken so many people's life. So there came the importance of biohazard safety. Okay, so how to protect the lab personals when they are working. Many people have died during COVID while doing the testing or research on it. You must be knowing about it. So what all precautions you have to take? So biosafety is the application of safety precautions that reduce laboratorians' risk of exposure to a potentially infectious microbe and limit contamination of the work environment and ultimately the community. So you are saving the personal, you are saving the environment and also the outside environment, because if the person who is working there, he contracts, if it is a viral disease like the COVID, he takes it, he will go to the community, he will mix up and he will give the infection, right? So how it became in the whole pandemic. You can understand. Throughout the world it has spread. So that is like the importance. So, and we have got certain biosafety levels. So all organisms are not that vulnerable. So we have designed certain organisms according to their pathogenicity or the infectious potency. So next is the high risk microbes and low risk microbes. The low risk microbes, if you say, we are saying as BSL-1, this is called as biosafety level. BSL-1 is the lowest risk microbes, BSL-2 and BSL-3 and BSL-4. So BSL-4 is highest risk microbes. They are the exotic microbes. Okay, so to protect laboratory workforce and the environment. That is the whole aim of this labeling of the biosafety. Biosafety is a discipline that addresses the safe handling and containment of infectious microorganisms. Containment means keeping it there, not allowing to spread, not allowing to transmit. Okay, and biohazardous material. Bio means life. Okay, and hazard is hazard, you understand? Okay, now, first one is BSL-1. We are going according to from the bottom we are starting, the least infectious. BSL-1 designed for those working with microbes that don't cause disease in healthy humans. For example, non-pathogenic E. coli, there is another organism which is not that vulnerable, and if you are working in that, you can have a simple tabletop. PP is recommended, lab coats, protective eye gear and gloves. So here we have a picture of biosafety level 1 lab. So we will go one by one. This is a control access. Any lab will have a controlled access. Everyone cannot go in. Your patients cannot go in, right? You will have restricted entry, and you will have a biohazard symbol. Can you see that? There is a biohazard symbol is there. So it's restricted entry. A controlled access. Hand washing sink. There is a sink there. Then sharp hazard warning policy. There is a policy there. It's written where to dispose the sharps. The sharps, when you're working in a lab, there are many things that you have to discard. Okay, there are sharps which you have to discard, which you have been using. So the sharps are like needles, blades and all, right? Those goes in a container which is a very sturdy container, tough container. That goes for the incineration. You have to process it in the incineration, that is, it turns into ashes. Big hospitals has their own incinerators. That's how it functions. Sorry. Then you have sharp hazard policy and then personal protective equipment. The personal protective equipment, what you can see here, he is wearing an eye cover or eye shield. He is wearing a coat, covered shoes and gloves. Then the laboratory bench is there and you have an autoclave. This autoclave is used to sterilize all the things that he wants to send it for waste. Okay. You will see this in your labs also. This is BSL-2 lab, which is you will find in your lab when you go. In microbiology lab, you will see this BSL-2 hoods. These are laminar flow hoods for the protection of the person who is working. Usually seen in the teaching hospitals. Most of the diagnostic labs. Many labs you will see, right, nearby. So if they are doing any work, they use these laminar flow hoods. There is a BSL-2 labs. Usually working with Staphylococcus aureus or Vibrio cholerae-like organisms, viruses like HIV. Next is BSL-2, is a whole diagram where you say controlled access, then hand washing sink, sharp hazard warning policy, physical containment device. This is a laminar flow hood where only the hands can go inside, hands will be going inside. There is a physical containment, means physically is a barrier. There is UV light inside to decontaminate the environment inside. So whatever his aerosol is producing with the pipettes for working, only his hands will go inside. the person, and that particular environment will be decontaminated with UV light. UV light kills germs, you know that, right? So that is to be done after once the work is done, he has to clean it with the UV. And also there is a gush of air which comes, air curtain is there, so it doesn't contaminate you. So that is all you have in this facility. Next is the BSL 3. So we are going step ahead, right? These are more infectious, the organisms you are dealing with. BSL 3 labs, the microbe there can be either indigenous or exotic, and they can cause serious or potentially lethal disease. It can cause serious or potential lethal disease like COVID. That has happened. COVID. The SARS-CoV-2 virus is the causative organism of COVID. And also Mycobacterium tuberculosis, which can transmit by inhalation. These all are inhalation, they can transmit. It has happened, people who are working with tuberculosis, they are doing research. These are not found in diagnostic labs, these are usually in research labs. Okay, so research labs, if they are not properly, if the lab is not properly designed, or he has not taken the proper precautions, or he is not wearing his proper, lab coat, his mask and everything, and 95 mask is going to be worn. So all those things, if you're not following, then respirators also you use here, then he may catch the infection, even for COVID. And then HEPA filters. I'll talk little about the HEPA filter. You understand filter, right? Okay. So these HEPA filters are, the full form is high efficiency particulate air. HEPA filters are the air filters that can remove at least 99.97% of airborne particles that are 0.3 micron size or larger. So even that size, 0.3 micron, you can understand. So you have to see them with electron microscopes, not with a simple microscope. They can filter it. So before sending the air to every environment, this air, the exhaust, this goes outside, right? We have got this air conditioning thing, the air will be, there is ventilation, right? So anywhere, even that lab which is dealing with so much exotic organism, the air has to go outside, right? Exit has to be there. So that cannot contaminate the environment. So you need those HEPA filters. The HEPA filters are very important. So you can see here, you can see this laminar flow hood where he is going to work, the person, and this is the duct which goes to the HEPA filter. Okay. You can see this exhaust HEPA filter here. Okay. So this HEPA filter again has to be replaced every 6 months. There's a quality control of this HEPA filter. These are to be cleaned. So all those things are in the policy of the hospital. Hospital infection control policy. There's a whole hospital infection control policy. There's a team who will be working it, seeing that there is done. So, next you come to একটা slide. So what you see in BSL 3 with the risk-based enhancements, you have, where I was talking about the HEPA filter, then you have the controlled access, personal shower out. So when the person goes out, he has to take a shower. Sharp hazard warning policy, as we have seen in all of those. Hand washing sink is there. Sealed penetration. So this is the laminar flow hood where he will be only putting his hands inside. It is sealed. The whole environment inside is sealed. Only he can work with his hands inside. Okay. Then you have physical containment device. There is a laminar flow hood, as I told you. Powered air purifying respirator. You see this person who is wearing a respirator. These respirators are specially designed. It's like a helmet there. So he will be giving his oxygen only to his own face so that he can inhale. So the whole purpose of this is, if he is working with any of the exotic organisms like COVID, this SARS-CoV-2 or any tuberculosis bacteria, then that doesn't infect him. Okay. So, but he can inhale the fresh air. So that is there already. So powered air purifying respirator, laboratory bench is there, then an autoclave is there inside there, so that he can decontaminate all the things he has used in that autoclave before it goes for the discard or it goes in the environment. Then you have exhaust HEPA filters. I talked about the HEPA filters. Effluent decontamination system. Every hospital has got an STA plant, where the sewage treatment plant. So when you are washing your hands, he'll be washing his hands, right, with water. So that also is maybe contaminated. So you have to treat that before sending it to the environment. So that is called the STA plant. If you have a hospital here coming up, even in IGM you're going, there's a STA plant. Okay, so this whole thing comes under the BSL 3 labs. Next is the BSL 4 labs. We have 4 BSL 4 laboratories. CDC Atlanta is, in USA you have few, every country has one. In India we have NIV Pune with BSL 4 lab. I have visited, fortunately, for 20 days I was in a training for virology in NIV Pune. So they have got a BSL 4 laboratory facility. Now let us see what is in that component. Here are very small, like NIV Pune, the microbe in BSL 4 labs are dangerous and exotic, posing a high risk of aerosol transmission. Infections caused by these microbes are frequently fatal and without treatment or vaccines. They are usually found in research labs, right? So maybe we don't have any vaccines for them, or they are doing research on those exotic viruses. So few of them examples are like Marburg virus, hemorrhagic fever virus, or Ebola. So we have got lot of stringent methods. If a person is working inside in that lab, he has to follow all those. So let us see some of those. What are they? Change clothing before entering, shower upon exiting, decontaminate all materials before exiting. Everything has to be decontaminated in the lab itself. Nothing can go out. Okay. Before decontaminating, safety equipments, wearing a full body air supplied positive pressure suit. We'll see that. And air supplied positive pressure, the suit is designed in such a way, it is also called as hazmat suit. Suit is designed in such a way that if there is any puncture in that suit, even then the viruses will not enter inside will not infect him. Okay. Next is facility, where facility construction is made in an isolated place. HEPA filters has to be used. The laboratory is in a separate building or in an isolated building, where other people cannot go. Only the researchers or the persons who are specially trained for it can go. The laboratory has dedicated supply and exhaust air, as well as vacuum lines and decontamination system. So this is the BSL 4 laboratory, which you can see here as a schematic diagram. So you see self-closing double doors. There are 2 doors here. One is first door, second door, self-closing. Controlled access, obviously. Then sharp hazard warning policy is there. Hand washing sink. Sealed penetration. This BSL 4, this again sealed penetration. Positive pressure protective suit. See, he looks like an astronaut, right? So yes, same way as in the space. There is no chance if you can, you have to seal the thing inside, the whole thing, top to bottom. So it's the same way. He has to have an hazmat suit, which is positive pressure protective suit. You see those tubings, which is his oxygen is there, supply. Then laboratory bench is there. We have got an autoclave for decontaminating all the waste he has generated in the lab. And then we have chemical shower out. So he has to have one shower facility, this chemical shower. And then again this simple shower, 2 showers he has to take. And then exhaust, you can see the HEPA filters and effluent decontamination system. So here I put a beautiful picture of the showers, how they are basically supposed to do. So here's a bibliography of all the references that I have used in my slides. So any study you do, you have to put your references from where you have taken, so that you know where, if anyone wants to refer, you can go back, and if you want to have a detailed study of it, you can go and click there or go in Google search and you can see more about this. I will encourage you to read about it, patient safety, biohazard safety, learn more. This is very interesting things, right? So just don't go home and just close your books. Open your books, try to, whatever you have material, nowadays you have in Google search, you have got a lot of materials. Try to go to CDC sites, okay? There fantastic things are there, everything you want to read about patient safety will be there. Because in a small class of 1 hour, I cannot cover so much, right? If I'm taking more time. So, but you try to develop yourself a habit of reading more. 3 questions I will ask, 3 questions I will ask you to maybe go home and read this. Who is responsible for patient safety? Doctors, nurses, patients, everyone. Just one answer. Who is responsible for patient safety? Everyone. What is the most effective way to prevent the spread of infection? Covering your mouth when you cough, washing your hands, wearing a mask, face mask, avoiding sharing drinks or food. Washing hands. See, you know now everything, okay. If you have a question that about your care, what's the best thing you can do? Research it on your internet, ignore it and trust everyone will work out. Speak up and ask your healthcare provider, ask a friend or family member to find out the answer. Very good, excellent class. Okay, now I put on slide individual commitment to a group effort. That is what makes a team work, right? A team, you're working in a team, you're seen in the hospital, you have to work in a team. But individual commitment is important. Everybody is important in a team, right? So that your team works and a company, that's how your establishment will work better. The society is going to flourish and also the civilization will work, right? So I have a last slide here. See, I put on elephant, which is a huge animal, right? But these lions, they are not that huge. But if you see, imagine a disease, when you have a disease burden in a patient, which is very huge problem. But when you work in a team, collaboratively with good communication skills, taking patient safety measures, with all the measures, you can definitely work out. You can definitely help the patient, right? Thank you.